Well, I'm Sharon Henry. I'm an associate professor of surgery here in the Department of Surgery, and I work at the Shock Trauma Center. I'm a trauma surgeon first, and I also run the wound center or the wound service here at University of Maryland. As I mentioned, I'm a general and trauma surgeon, so one of the needs that the people planning this foresaw was the need for people to do general surgery, to take care of wounds, and just to manage patients on a general basis. So my role was to be there in case there was a need in the operating room for soft tissue debridements, for whatever procedures, general surgical procedures would be necessary. And to also use my expertise in wound management, because one of the things that happens in earthquakes is there are a lot of wounds that need care, and to try and develop a plan to take care of those wounds on the patients. The conditions in Haiti, Haiti was, as you expect, it was hot. I didn't prepare for the amount of dust that was around. You can imagine with so many buildings collapsed. It's like being in a construction site, the entire city. So there was a tremendous amount of dust in the air, and every day after we spent the day working at the hospital, you just feel yourself caked in dust and sweat, and that wasn't something I was sort of had envisioned as part of it. From the standpoint of the conditions that the populace is under, the people who are most affected. I mean, it's interesting because there are places that aren't affected in Port-au-Prince, but the area we were in was kind of almost completely affected, and especially the hospital we were at. Collapsed buildings, partially collapsed buildings. Even the hospital we worked at, most of that hospital was collapsed. There was a vista from the rooftop of one of the buildings that was intact, where you could see just the total collapse of this building with patient beds, cribs even, that were crushed under the rubble. And that kind of gave you the reality of, hey, there were people in those beds. There were kids in those cribs. Significant losses, 10% of the population. Nursing schools collapsed with 3 years' worth of classes. So imagine the drain that's going to put on that small country who have been training those people to take their place in the healthcare community, and now they're gone. Hospitals collapsed with staff. Many of their staff members lost, as well as patients. And to, have us come in and take care of them, strangers, people they don't know, that they have to put their trust in, that we're doing the right things for them. And to have them just try. I watched a patient with an external fixator on her femur who was in her second trimester of pregnancy, and it's post-op day 2, and it's time to try and get up out of bed. And she was in tremendous pain, but made the effort to get out of bed, and ultimately got out of bed and was able to walk on one of the 2 pair of crutches that we had, which was not nearly enough to manage all the patients who were going to need some assistance with ambulation after their surgeries. It's bittersweet. I felt like, certainly as you sit back and watch things on TV, you certainly feel like you're not helping. Did I donate? Yeah, I donated money, but sometimes that you don't know that that's going to the right place and that that's going to actually reach anybody. I sent a text to my sister after I got there the first day, and we were tired and we were running around, and it felt like some of the stuff we were doing was, because we were there trying to organize where there isn't much in the way of organization. At the end of the day, sometimes you feel like, wow, what did I accomplish today? And, I had to say, at least I touched who I touched. I changed dressings. I, tried to comfort people. So when you look at it as a small piece, I think it's totally satisfying. But when you step back and you look at the 20,000-foot view and you look at what impact are you having globally over the whole the whole problem, you can see that the part we play is very small but very necessary. The only thought I have is that I'll definitely go back. This is a long-term process and a long-term project that the hospital has committed to. And, I'm very proud of the hospital for doing that, because many of the organizations and the people who are sending folks there are there for a short time. They went for a week right after it happened and they're gone. And the patients are still there, and the need is still there. We were still getting patients who, a month after this terrible tragedy occurred, had not gotten medical care. Fractures that had never seen any treatment whatsoever. The people were there trying to, just struggling in the camps, and finally made their way to find some help. So I'm very grateful for the support the hospital has had that allows us to be able to go and contribute.